So, even if you haven't heard of it, PAD is very common and very dangerous. Here's Julie Donaldson.
46-year-old Caroline Gentile is married and a mother of 3. She started experiencing pain in her legs over 3 years ago, and like many of us, she adjusted her lifestyle and just dealt with the pain. But when the pain turned into numbness and she started falling down, she knew she needed help.
The pain started about 3.5 years ago. The numbness and the falling started about 6-7 months ago. It was getting really bad. And I wasn't able to walk any length without incredible pain turning into that numbness, and my leg would just give way. I'd just fall.
Hi, Ms. Gentile.
Hi, Dr. Joe.
How are you?
Caroline was no stranger to doctors. She's had a heart attack. She is also a diabetic and has lupus. All these conditions required lifestyle changes, so she quit smoking after the heart attack and began eating healthier foods. But the one thing she heard over and over again was she would have to do some form of exercise, like walking. At that time, Carolyn tried explaining to her doctors that she couldn't walk without pain. But again, she didn't get anywhere.
I told many doctors, neuropathy, arthritis. Finally I mentioned, and they kept on telling me because of my other medical problems that to keep on walking and you have to walk, and I couldn't walk. And finally my cardiologist said that I was just too young to be dealing with this.
All right, so how'd we do, Miss Gentile, okay?
And Caroline was even too young to be considered at risk for PAD. Most patients are between the ages of 55 to 70, but the pain in her legs wouldn't go away, and it was seriously affecting her quality of life.
You know, they just went numb on me, and I fell.
It's important to understand that peripheral arterial disease is very similar to coronary artery disease, just that different arteries are affected. So while CAD causes chest pain, called angina, PAD causes leg pain, intermittent claudication. The risk factors for both conditions are the same and include smoking, high blood pressure, high cholesterol, and family history. Pain is the one symptom that gets at-risk patients in to see the doctor.
I could deal with pain. I've been through my fair share. I could not walk from one side of my bed to the other without being in incredible pain. I couldn't walk to my mailbox. There was no walking a dog. There was no cleaning the house or going food. There was nothing. I was just, the only time I wasn't in pain was when I was sitting down. So I was immobile because it was the only time I felt good.
What Caroline was experiencing is the most common symptom of peripheral arterial disease, intermittent claudication.
Warning signs of PAD are mostly related to the lack of blood flow that gets to the muscles in the legs. This classically causes a symptom that's called claudication, which comes from a Latin word meaning to limp. When a patient walks a certain amount of distance, the blood flow to the muscle in their leg will be inadequate, and then they will develop pain in the muscle because it's not receiving the oxygen that it needs to exercise.
The discomfort forces a person to stop walking because the ache is too painful. This pain is usually relieved by rest. The discomfort is most often described as an aching, tightness, squeezing, cramping, or heaviness in the leg. This symptom commonly occurs in the calf, but depending on the artery involved, may occur in the buttocks, hip, thigh, or foot.
I would start walking and the pain would start from my ankle all the way up to my thigh. And if I would ignore it, because I tried to ignore it and just deal with the pain, to like take a walk with a friend or do what I had to do, if I would ignore the pain and just keep on going, then it would go up into the top of my buttocks, and the pain would get so intense that it would just get numb. My leg would get numb. And then I couldn't hold myself up, it would just give out, and I'd fall.
After a period of time, Caroline figured out how to make the pain stop.
As soon as I stopped, if I stood still, I didn't even have to sit, if I just stood still for a few minutes, I guess the blood would start flowing again and the pain would go away. and then I can get a little bit more out of it. So it was a stop and go.
By the time Caroline was diagnosed with PAD, the arteries in her legs were extremely clogged, and there was a good chance she might lose her left leg. The fact that she had diabetes didn't help.
So diabetic patients are clearly at a higher risk of developing PAD. Some studies say as many as 40% of people with diabetes will have associated artery disease in the limbs. And their risk of losing a limb is higher regardless of PAD or not, but it just goes up even more if they have PAD.
Dr. Jaff was able to help Caroline by asking the right questions and listening.
He first asked me about the pain. He first asked me a few questions, and he said, if you give me the right answers, I think I can help you. I said, oh boy. So he asked me about when the pain comes, if I stand or if I sit, if I just stand, does it go away? And I said, yeah, it does. And then he said he thinks he can help me.
Caroline was fortunate to have a good doctor that understood her symptoms. But people with these symptoms should not wait. Early detection for PAD can offer immense benefits, especially for high-risk patients like smokers and people with diabetes.
We see that most of our patients with claudication, 98 or 99% of them, are smokers when we first meet them. If we can get them to stop smoking, we can actually see a double in the distance that they walk within about 6 months. Other disease processes such as diabetes or high blood pressure and increased lipids or fat in the blood, also if these can be better controlled, the symptoms of PAD can also be diminished relatively rapidly.